Assalamualaikum and a very good afternoon, everyone. I'm Dr. Norhayati Mokhtar from Vector-Borne Disease Sector, Disease Control Division, Ministry of Health. My presentation for today will be focusing on the public health aspects, particularly on the updates in dengue prevention and control methods and approaches that are being carried out in the field. And this is my outline of the presentation. First, I will touch on the dengue situational analysis in Malaysia, and we will also look at the vector control approaches in dengue prevention and control program in Malaysia, and what are the innovations or novel tools in dengue prevention and control, such as in Wolbachia mosquito release. We will also look at the STERILE insect technique and dengue forecasting system. And finally, I will summarize my presentation in the summary. First, let's look at the dengue situation in Malaysia. So this is the dengue statistics or dengue cases for the whole of last year, where there were 26,365 cases reported, as compared to the year of 2020, where there were 90,304 cases, which brings to the reduction by 71%. And similarly for the dengue death, there were also reduction by almost 86.2%, or reduced by 125 deaths, where in 2021 there were 20 deaths reported as compared to 145 deaths reported in the year of 2020. And for the case fatality rate, the CFR or case fatality rate reported last year was the lowest ever being reported, which is 0.08% as compared to the year before. The CFR was 0.16%. And this is the dengue situation until EPID week of 5, which is until 5th of February 2022, where we can see an upgoing trend in terms of cases, where in 2022, for this year, there were 3,573 cases reported as compared to last year, the same period of last year, there were 3,329 cases. So there's an increment by 7.3%, or 244 cases. And until now, there were no dengue death reported. And this is a graph that shows the weekly dengue cases in Malaysia for the year of 2021, represented by the red line. Cases in 2020 represented by the green line, and 5 years median cases, which is from 2016 until 2020, represented by the blue line. And as you can see in the graph, there's a huge gap in terms of number of cases reported last year compared to 2020 and 5-year median. And we can also see in the graph that there'll be always two peaks, or we call it as biannual dengue transmission period. And this is the dengue endemic pattern in Malaysia, right? So the peak usually will occur from June till September. That's the first peak. And the next peak, or the next transmission, will occur from September until March of next year. So there will always be two peaks, or we call it as biannual dengue transmission in Malaysia, right? And this slide shows the dengue weekly dengue cases in Malaysia from the year of 2013 until 2021, where if we observe, there is always surge in dengue cases in every 4 to 5 years, with a notable case surge in 2015 and 2019. So as you can see in the graph, there's a case surge in 2015, and in another 4 years, there's another surge in 2019, and we anticipate that there'll be another case surge somewhere in 2024 or 2025, right? And this is just to share number of dengue cases and death. So the number of dengue cases is represented by the bar graph, and the line graph represents the number of deaths. Yeah, so as you can see, number of deaths in 2021 was the lowest ever been reported, yeah, for the past 20 years, right? And this is the graph that shows number of dengue cases and incidence rate, and we can see a steady decline, yeah, in terms of the incidence rate from the year of 2019 until 2021. So in 2021, the incidence rate for dengue was 78 per 100,000 population. And this is just to show in terms of the number of dengue death and case fatality rate, as I've mentioned before. The case fatality rate for last year, yeah, was the lowest, yeah, ever been reported, yeah, for the past 20 years, which is 0.08%. And the number of deaths for last year, yeah, was 20 deaths, right? And this is the map showing dengue incidence rates by states in 2021, and as expected, the highest number of incidents were reported, yeah, from the states with highly populated, yeah, which is the Klang Valley, Selangor, and Wilayah Persekutuan Kuala Lumpur, right? And this slides actually shows two graphs, okay, where the upper graph shows the number of weekly dengue cases, yeah, reported from 2013 until 2021, whereas the graph at the bottom shows the dominant circulating virus, yeah, throughout the 9 years. And what I would like to emphasize here is that whenever there's a shift, yeah, in terms of dengue serotype, there will be surge in cases, yeah. For example, in 2014, there's a shift, yeah, from from dengue serotype 2 to dengue serotype 1, and afterwards there'll be a shift or case surge. There is a surge in cases reported. And if we look in 2018, the same scenario occurs, where when there's a shift from DEN 2 serotype to DEN 3 serotype, there's a case surge in 2018, and throughout in 2018 to 2019, and throughout the year, the dominant circulating virus was DEN 2. However, when we look at last year, 2021, there was a shift from DEN 3 to DEN 4. However, we hardly see any surge, yeah, in cases, but this could be due to the lower sample, a low number of sample reported last year, right? And then let's move to the vector control approaches in dengue prevention and control in Malaysia, right? So the main objective of vector control is to reduce the abundance of vector population, which is the mosquito density, to the level that it may not allow transmission to occur. However, the threshold is still undefined, yeah? And these are the mainstay of dengue control measures in Malaysia. First is the source reduction, or known as penghapusan tempat pembiakan, or PTP, yeah, among our health staff. Secondly is the larviciding, right? And third is space spraying, or known as semburan ruang thermal, or popularly known as fogging, right? And the fourth is the targeted outdoor residual spray, or targeted ORS. And apart from that, the health promotional activities and the law enforcement is still ongoing here, as the conventional way of dengue prevention and control. So the source reduction is by doing the search and destroy of Aedes breeding places, and the source reduction, yeah, has been and continues to be a key component of dengue and chikungunya control programs, where it must be initiated within 24 hours after the case notified in the e-dengue system, and the premise coverage must be 100% within 3 days, right? And in terms of the radius of the coverage, for single case, the health staff, our health staff, must cover 200 meters for single case, and in the situation of outbreak, they must cover 400 meters. And the source reduction activities is done by the health inspectorates, the pegawai kesihatan persekitaran or pembantu pegawai kesihatan persekitaran at the district health office, the PKDs, or by the local council or the PBTs, And the source reduction is also carried out by the pest control operators, hired by the PKDs, right? So this is a few pictures showing the search and destroy activities being done at the ground, right? And secondly is the larviciding. They comes in various forms, such as in sand granules or capsules or solutions. Usually, the larvicides that are being used is the thermiphos or BTI, which is the biological form of larvicides, And the larviciding will be done at sites that has potential breeding containers, for example, at the back lane or empty lots or bushes or building structure or defect building structures. And that's a term called community larviciding, where the communities themselves, will conduct these larviciding activities, And these are pictures that shows a various form of larvicidal activities, where they can use spray cans or mist blowers or the conventional abating, using the sand granules, right? And this is the larviciding activities done by the communities, for example, by the combi volunteers, done at their neighborhoods or in their area. The third is the space spray of adult Aedes space spray or fogging, popularly known as fogging. It must be done within 24 hours after the case notified in the e-dengue system, and the locality must cover 80%, 80% of the premises, and similar as in source reduction. For the single case, it must cover 200 meters, whereas in the situation outbreak, it must cover 400 meters. It must cover indoor and outdoor, and it is usually done during dawn and dusk, which is the peak biting hours of the mosquito. And in case the premises are closed or the owner quite reluctant to allow our staff to enter their premises, we encourage the use of the aerosol spray. And in terms of in the situation of outbreak, the thermal fogging or the spray must be complemented with the ULV, right? So these are a few pictures showing preparation of the preparation before the fogging activities being done. Okay, they are preparing the fogging machines before the spray spraying, right? And these are the spray spraying done, which is usually done during the dawn, and dusk. Okay, and there's another new approach or new initiative by IMR, which is the targeted outdoor residual spray, where the operators will apply a low dose of insecticides onto the outer surfaces, usually onto the wall where mosquitoes are suspected to hide or rest. And these residual activities will last between 2 to 3 months, and this ORS is usually done as a preventive method in dengue hotspot localities or areas with recurring dengue cases. And it will be done at least for 2 cycles of spray, and it will be repeated for every 3 months. But the disadvantage of this method is that it is laborious. It needs more manpower to complete the task at one locality. Okay, And apart from that, there are these are the conventional ways of educating the public, okay, which is health promotional activities. And for the health promotion activities, it depends on the type of cases reported, whether there are single case, or control outbreak, or uncontrolled outbreak, or hotspots. And so these are the activities being done. Yeah, for example, announcements of siar raya, or hebahan in the TVs or radios or in the social medias. Yeah, there'll be also banners, posters, flyers, community mobilization, health educational kiosk at hotspot area, and also dialogues, right? So these are examples, yeah, of how the promotion activities being done, yeah, through the radio or TV interviews, posters and banners, and also announcements, right? And in terms of enforcement, there is an inspectorate and law sector or unit that look into the enforcement part, and they will also conduct a regular operation called this OGA, Operasi Gempur Aedes, and a compound of 500 ringgit, yeah, will be issued, yeah, to those found to breed disease-bearing insects. Yeah. Okay. And let's have a look at what are the new initiatives or approaches in dengue control. I will touch briefly on Wolbachia mosquito release, sterile insect technique, and dengue forecasting. So first is the Wolbachia mosquito release, right? So I'll explain briefly on what a Wolbachia is all about. So actually, Wolbachia is a gram-negative bacteria naturally found in 60 to 70% of insects, and it can only live inside the host cells, not in the environment. Okay? It cannot be transmitted between insects, and since it cannot survive outside the cells, it has to be injected into the egg of Aedes aegypti using a technique called microinjection. Yeah. So this is how the Wolbachia is transferred to Aedes aegypti mosquito. Yeah, so Wolbachia is injected into the eggs, and eventually the eggs will hatch and become a Wolbachia aedes adult mosquito. And this graph shows the impact of having Wolbachia in the mosquito, yeah, as we can see in the x-axis, versus the existence of the dengue virus in the mosquito saliva in the y-axis. Yeah, so mosquito without Wolbachia, yeah, for the mosquitoes without Wolbachia, we can see that viruses were found in the saliva, yeah, whereas for mosquitoes with Wolbachia, there is viruses found in the saliva. And how did Wolbachia block the virus replication in the mosquito? So this is the theory that were told to us. Yeah, first it will boost the natural immune system of the mosquito, and secondly, Wolbachia will compete with virus in consuming the cholesterol inside the mosquito, and this will make the dengue virus hard to grow. Right. And the field trial phase was initiated by IMR in 2017, with all of the localities shows reduction in number of cases, yeah, as compared to the control site. And in view of the promising results, yeah, from the field trial phase, Ministry of Health adopt this method in the operational phase that starts in 2019 with 11 localities with high dengue burden. And for this operation, the budget comes from Ministry of Health, and we distributed them to the PKDs and JKNs. And this project involves multidisciplinary teams. Yeah, it involves the epidemiologists, entomologists, health inspectors, health education officers, as well as the community, yeah, the committee leaders, the JMBs, the local municipals. And in terms of prevention and control activities at Wolbachia release site, a big no, in terms of prevention is that there will be no fogging, as it will kill our Wolbachia mosquito. And in terms of dengue enforcement, it goes on as usual, right? And there are criteria for the locality selection, right, that need to be fulfilled. For example, it needs to be localities with high dengue burden or dengue cases. And in terms of the type of premises, the priority is the high-rise building, as we can see a significant reduction when it is released at a high-rise building or flats, right? There also need to be natural boundaries, for example, rivers, highways, or fields. This is to prevent immigration of wild mosquitoes to the area. And there shouldn't be any industrial sites, because it will kill our Wolbachia mosquito. Area of at least 0.6 kilometers square. We also look at the number of households, and most importantly, there must be a good public cooperation and support, right? And there are two Wolbachia strategies, that is replacement strategy and population suppression or suppression strategy. But in Malaysia, we adopt this replacement strategy whereby in replacement strategy, both the female and male Wolbachia were released, and over time, the Wolbachia mosquito will mate with the wild population, and eventually, all of the population in the release area will carry Wolbachia, right? And these are the states involved in Wolbachia mosquito release, where we divide them into cohorts. For the first cohort, started in 2019, there are 11 localities consisting of Selangor and Wilayah Persekutuan Kuala Lumpur, followed by the second cohort, where there is an additional of Pulau Pinang, and the third cohort, we hope to accomplish 30 localities, but until now there were only 3 localities in the third cohort, and the remaining localities, we will try to release them for this year. And all of these 22 sites are all recalcitrant dengue hotspots, and majority of them are of high-rise building. Okay. So there are 2 endpoints that we monitor during the release. First is the epidemiological endpoints, or the weekly confirmed dengue cases in the area. And secondly is the Wolbachia frequency in the environment, or the entomological endpoints, right? And these are the results. After 6 months, we are comparing 6 months before release and 2 years or 24 months after the Wolbachia release. And as we can see, all of the locality of the first cohort shows reduction in number of cases from 75% until 100%. So all of the localities shows reduction in number of dengue cases. And this is in the graphical form, where we can see number of cases before 6 months before release, and 24 months or 2 years after release. All of the localities shows a reduction in number of dengue cases. And this is just to show a few localities that before the release, and in 2021, where we can see this is in section 13 Petaling. There's a significant reduction here from 2019 until 2020, where the cases starts to drop, and there were only few cases reported in 2021. And this is in Pelangi Damansara, also in Petaling. So we can see there's quite a number of cases. The burden is quite heavy in this area in 2019, but there were only few cases reported in 2020, and 2021, right? And this is PPR, Desa Tun Razak, okay, one of the recalcitrant dengue hotspots. But we can see, yeah, as time goes by, in 2020 there were reduction and lesser case, yeah, in 2021, right? So these are the pictures of preparation before the release of Wolbachia mosquito by our health staffs, yeah, in the ground. So they are preparing the release container, yeah, where we need to put water and eggs, as well as the food, yeah, the larvae food, and this is where we put the release container at the post box, right? And there are certain days that we need to come and open the lid, yeah, to release the mosquito, the Wolbachia mosquito, right? And this is the preparation before release of adult Wolbachia mosquitoes, right? Okay, then we'll move to the second innovation or novel tool, is the sterile insect technique. So the SIT was among the first biological insect control methods for wide area application. And for the past 70 years, the control methods were heavily dependent on chemicals. So there are issues on insecticides resistance on pollutions. And in view of that, IMR has conducted a trial phase study on SIT in 2019 in collaboration with the Malaysian Nuclear Agency. And until now, in terms of the radiation process, yeah, was done at the Malaysian Nuclear Agency. So SIT can be called as a birth control of insects, yeah, for suppression or to eliminate the target pest population. The advantages is that there are environmental friendly, species specific, cost effective and sustainable biological pest control method. And the radiation, the sterilized insects are considered radioactive free, and this method was developed in 1950s, yeah, by these two scientists. So this is basically what SIT is all about. So first there'll be a mass rearing of insects, yeah, took place at a special facilities, and the male and female insects are separated, and then the ionizing radiation is used to sterilize only the male insects, and afterwards the sterile male are released to the localities, and the sterile male will compete with the wild male to mate, yeah, with the female, and the mating of the sterile male with wild female will result in a non-viable eggs that or the eggs produced will not hatch, and eventually it will cause a population crash or suppression, yeah, of the mosquito population. So this is another illustration that shows where the pupae will be radiated, and there will be a sterile male that mate with female insects, and there will be no offsprings, yeah, because the eggs will not hatch, right? So basically there are two phases of study. The first phase is the lab experiments, yeah, and the second phase is the open field release, yeah. For example, there will be mass rearing and site selections, which is usually hotspots, and in this case IMR has chosen Malacca as the trial location, and there will be community engagement, yeah, to tell all the community what is SIT all about, and there will be surveillance of Aedes aegypti population. And these are pictures that shows the sterile males, yeah, per cup, where they will be fed with sucrose every day before the release, right? And this is the results where we can see that overall of the Aedes aegypti density reduced by 96%. Okay, so there is a suppression of the larvae by 96% at the release site compared to the control site after 16th release, right? And in terms of number of dengue cases, also shows a reduction, yeah, as compared to the control site, right? I would like to acknowledge Dr. Nazni for all the slides on SIT, because at the moment, the SIT is only done under IMR. It is not yet being operationalized at KKM, yeah, right? And the third one is the dengue forecasting system, where we use this system to forecast dengue outbreaks with sufficient lead time to allow for effective interventions. And this is considered as an early warning system developed by the UK Space Agency, or DMOS, yeah. And we have used the system as a pilot project since November last year, and we noticed that it may serve as a decision support tools, yeah, to provide information for planning and decision making. And this system managed to predict outbreaks 6 months in advance, right? So this is the dashboard, yeah, of the dengue forecasting system that we're currently using now, the DMOS, where basically the system used 20 years of historical Earth observation data from satellites. So the variable that are being used or taken into consideration is the temperature, humidity, rainfall, soil moisture, land cover, wind speed, and etc. And in terms of cases, KKM we have provided, yeah, the developer of the system with the 10 years epidemiological data, which is the dengue cases. So by using data, 10 years data, okay, this is when the forecast issued, and we have 24-week lead time, yeah, before the predicted occurrence of dengue took place. So we have ample time in terms of prevention and control, in terms of planning, yeah, in the prevention and control. So this is the dashboard, yeah, of the system that we are using now, and the forecast goes by district, yeah. For example, this is the forecasted area in Kuala Lumpur. Before this vertical line, before the vertical line is the actual number of cases, and after this vertical line is the predicted or forecasted number of cases. And as we can see, it is predicted that in June, yeah, from January until June, there will be increase in terms of number of cases in KL, but still it will not exceed the threshold, yeah. And coupled with a stratification of dengue locality, because the system only predicts increase in number of cases by district, but we do not know where to act on. So we have to also rely on stratification of dengue locality, which is the priority localities. There are 4 categories of priority localities, and we also have these priority premises, which varies within states and districts. So by using the system, the forecasting system, together with this stratification of dengue locality, okay, we will target on the prevention and control approaches, right? So as a summary, first is that dengue prevention and control is a shared responsibility. It is everybody's responsibility, and therefore continuous efforts are required to sustain cooperation from communities in maintaining search and destroy activities. And during the COVID-19 pandemic, we realized that there's a competing priorities in terms of financial support, attention, and synergistic collaboration from all stakeholders, and therefore there need to be a refocus for the essential duty, especially among healthcare workers at the district and state level. And for the third point, we noticed that during current relatively low burden of dengue, there need to be a paradigm shift in terms of control mode to preventive mode by using the dengue forecasting system, right? And for the Wolbachia, by looking at the result, we believe this method is promising, and therefore we will expand this project to other high dengue burden localities. And finally, to combat dengue, there's no magic bullet, there's no standalone tool, and therefore we have to use integrated vector control management. We have to combine all of the methods to combat dengue, right? And these are the messages that we always have to emphasize to the public. First is to conduct the 10-minute search and destroy every week. Secondly is to always protect themselves against mosquito bite by using repellents or using the aerosol spray at home. And most importantly is to seek early treatment if they have fever and any of these two symptoms. So these are the messages that we really have to emphasize to the public, right? And I would like to acknowledge the scientists from IMR, Dr. Nazdi and Dr. Nurul Husna, as well as to PKD Petaling and Kombi Pulau Pinang, for their slides and for the photos, right? And I think that's all for now. Thank you for listening to me, and have a good day. Thank you.